Thank you, Dr. Quinones. I'd also like to thank Dr. Emma Fernandez-Repollet for making this seminar possible, and it's great to be with you all today. So, let's go ahead and get started here. The topic is the NIH Public Access Policy. Here's the keyboard. Okay. And I wanted to begin. Let's see if I can get the slides to go here. Okay. I wanted to begin by asking this important question: why is the NIH Public Access Policy important to you? And the reason it's important is because compliance equals funding and non-compliance equals delayed funding. So it's very practical and very relevant for all of you, whether you're a principal investigator of a grant or a program coordinator, a program manager, a staff person working on a grant. This issue is very relevant for the funding situation at your institution. And it's important to note that very recently, beginning in 2013, the National Institutes of Health has begun to really step up their enforcement of this policy. And it's becoming more and more of an issue for all of the grants that are funded through NIH. So let me give you an overview of the topics that we're going to address today. There's going to be 4 topics. Actually, there's going to be a 5th topic at the end as well. The first topic will be just an introduction to the public access policy. The second topic will be addressing specifically the responsibilities of authors. So if you are an author or a co-author of a scientific publication that's funded by NIH, then you have specific responsibilities that you need to fulfill. If you are a staff person that works for a faculty person who is publishing articles, you may also be involved in some of these steps. The third topic we'll deal with is related to the second topic, but shifting the focus slightly to what are the responsibilities of the PI. The principal investigator has other responsibilities that are related to the authors, but a little bit different. Then fourth, we're going to focus on how do you deal with if you have a specific paper that is out of compliance with this policy. What are the steps that you can go through to try and troubleshoot that paper and bring it into compliance? This might be one of the most helpful things for you if you are a staff person, you're working on a grant, you know that you have your progress report due in a few weeks or a month, and you see some non-compliant papers. What do you do to get those papers back in compliance? And then, as I said, there's a 5th additional topic that might be more relevant for administrators at the institution, but that is, what are some strategies that we can put in place to enhance compliance with this policy here at the University of Puerto Rico Medical Sciences campus? So let's begin then with just giving an overview, an introduction to the policy. So I'm going to put on the slide here a number of icons that you might have seen before, and it's somewhat confusing because there's so many, and you might be asking, how do all these things relate? NLM, NCBI, PubMed, all these terms, right? What's the connection between all of these things? So I'm going to give you a brief overview of that. We'll start with this, the National Library of Medicine. The National Library of Medicine is a division of the National Institutes of Health. It's located in Bethesda, Maryland, and it's one of the world's largest medical libraries. It contains 7 million books, journals, technical reports, manuscripts, microfilms, photographs, and images related to the broad topic of medicine. Now, within the National Library of Medicine, there is an organization called the National Center for Biotechnology Information, or NCBI. So when you think of librarians, you don't normally think of people who are techie, right? Like people that work for Google, the scientific techie computer people. Well, within the National Library of Medicine, they do have this one division called NCBI that is those people. These are the guys that take computer science and apply it to biotechnology information. NCBI is a division of NLM, and NCBI runs several biomedical databases. For example, they run PubMed. They also run PubMed Central. We're going to explain those in a minute. They run GenBank, which is a searchable database of DNA sequences. And they also run the epigenomics database. And there are some other things that they do as well. Applying large data sets and using computer science to help provide information regarding biotechnology. So I mentioned these two databases that are run by NCBI under NLM, which is a division of NIH. There's PubMed and PubMed Central. So PubMed, which is operated by the National Library of Medicine through NCBI, is a free search engine that primarily accesses a database called Medline. Medline goes back to the 70s, from 1971 to 1997. Medline was primarily accessible only through large institutions like universities. You had to go to the library physically and sit down at a computer in the library of the university in order to have access to Medline. But then in 1997, it was made public to the public through the internet. And Vice President Al Gore, you remember that guy, right, back in the 90s? He was the one who sort of publicly unveiled this and said, we're going to make Medline available through PubMed to the public. It is a searchable database of references and abstracts on life sciences and biomedical topics. So that's the key phrase there. It's a database of references and abstracts. So when you search PubMed, when you get the results, you'll see the reference, which is the authors, the title of the paper, the journal, the volume, the year, the page numbers, and you also get an abstract, a one-paragraph summary of what that paper is about. So that's PubMed. Now there's also PubMed Central, and I want you to remember those three letters, PMC. We'll be using those three letters, PMC, throughout this talk. So keep those in mind. PMC, or PubMed Central, is a digital repository of full-text biomedical journal articles. It's also operated by NCBI, just like PubMed. And it allows the public to have free access to the papers themselves. Not just the abstracts, but the entire paper. And that's why this policy is called public access, because of this PubMed Central that has the papers. The PubMed Central archive currently contains 3.2 million journal articles. That's a pretty sizable chunk of biomedical scientific research that's available. So it's important to distinguish then in your mind between these two entities, between PubMed and PubMed Central. Both are run by NCBI under the division of NLM, but don't confuse them because they're very different services at their core. PubMed is a database of biomedical journal citations and abstracts, and the unique identifier that each record has is called the PMID number. PubMed Central is a digital archive of free full-text journal articles, and each record in PubMed Central has a unique identifier called the PMCID number. So PMID and PMCID are not the same. And a lot of times authors will say, I'm in compliance with the policy, I have a PMID number for my paper. No, you're not in compliance just because you have that. In fact, NIH doesn't even care about that number. All they care about is the second number, the PMCID number. That's the one that shows that the paper is in compliance with public access, because that proves that it's available on PMC, on PubMed Central. So what a difference one letter makes. Now, one question that people have about this whole topic is why? Why does NIH require public access? Well, the reason is because the taxpayers have an expectation that the research that they're funding through their tax dollars ought to be made available to them. And as I mentioned, there's over 3.2 million articles currently in PubMed Central. And there are about 800,000 individual users who log into the system every single day to search for issues related to science and biomedicine that are relevant to their lives, specifically to their health. And these users download approximately 1.5 million articles every day. So that gives you an idea of the demand that's out there. And it's very practical. It's very real. I mean, if you have a specific health issue, maybe something that's not very well known, and you want to know what the latest scientific research is about that issue, you can type in the terms, and you can find the latest scientific results on that particular issue. My own father recently was infected with West Nile virus, and as a result, he got slight paralysis in one of his legs, flaccid paralysis. So I went on to PubMed Central, typed in West Nile virus flaccid paralysis, and there were dozens of articles specifically on that one issue. And I was able to print them out, show them to my dad, take them to his doctor, and you can get the latest insights into what is going on scientifically on these issues, even though it might be something that's not very well known. So it's very helpful and very practical. Now there's another benefit as well to public access, and that is it not only helps the public, not only helps you and me, but it also helps the scientific community. For example, biomedical researchers themselves, they don't want to have to go down to the library, pull the journal off the shelf, open it up and photocopy it, and then take it back home to they want to be able to get the information right away. So biomedical researchers themselves will go to PubMed Central and quickly get access to get a picture of what is going on in their field, or even perhaps in a related field that they don't know very well, but they want to get some insight into it. Interestingly, even NIH itself uses it. They use it in order to get a picture of what's going on with the research that they fund. So they can monitor, mine, and develop the portfolio of taxpayer-funded research more effectively. This also allows NIH to put the results of their funding out to the public, so the public can see this is what is being done with your tax dollars, so it becomes more prominent. And public access also enables scientists to pursue NIH's research priority areas more competitively. So for example, if you're a PI and you are thinking about applying for a particular grant, let's say you're looking at an R01, and you want to know what are the areas that NIH is interested in. Or you want to know what are the areas where there's more work that needs to be done. There's only 1 or 2 studies on this one topic. You can go into PubMed Central and find that out. You can see, here's where the need is. We need to do some research in this one particular area because there's nothing on it, or there's only one paper on it. You can tell through PubMed Central very quickly where those areas are. So public access is very beneficial for the public and for the scientific community. Let's look at the law itself. In 2008, Congress passed the following law. This is called Public Law 110-161, Consolidated Appropriations Act. So this is a federal law that was passed by Congress. It's called a policy, but really it's a law, federal regulation. And this is what it says. The Director of the National Institutes of Health shall require that all investigators funded by the NIH submit or have submitted for them to the National Library of Medicine's PubMed Central an electronic version of their final peer-reviewed manuscripts upon acceptance for publication, to be made publicly available no later than 12 months after the official date of publication, provided that the NIH shall implement the public access policy in a manner consistent with copyright law. So what are you supposed to submit? You're to submit the final peer-reviewed manuscript. When do you submit? Upon acceptance for publication. Where do you submit? To PubMed Central. And then there's 3 criteria that need to be met in order to know if your paper falls under the policy. So this policy applies to all published papers that are peer-reviewed. So in other words, it doesn't cover things like letters to the editor, right? This is for peer-reviewed papers. It only applies to papers that were accepted for publication on or after April 7, 2008. So prior to that date, it doesn't apply. And the research that is being reported in the paper must be research that was funded through NIH. So if it was funded through private industry or the National Science Foundation, then you don't need to, it's not required for the paper to be on PubMed Central. You could still do it if you wanted to, but it's not required. Note that papers that you cite in your biosketches, in your proposals, and in your progress reports do not need to have a PMCID number if they were accepted for publication before April 7, 2008. So when you look at a faculty member's biosketch, right, they have their most prominent papers that they're putting forward. You'll see that there's a certain point around the year 2008 where that's when they start adding the PMCID numbers. Before that date, they probably won't. Again, though, it is something that's allowed. If you want to submit your papers, even the ones before 2008, you can do that as well. But it's optional. It's not required. So, as I mentioned at the beginning, the issue of compliance comes up. A grantee's failure to comply with the public access policy may cause NIH to take one or more enforcement actions depending on the severity and duration of the noncompliance. After all, it is a federal law, and so it's a condition of funding that you follow this. And if you notice, when you receive the Notice of Grant Award from NIH, there's a section called Section 3, Terms and Conditions. And there's this one sentence that's there that is now very clear and very clearly stated that in accordance with PL 110-161, that's the one that we just quoted, compliance with the NIH public access policy is now mandatory. So it's part of the condition, the terms and conditions of the notice of award. So for the annual non-competing progress reports, the notice of grant award for the next grant year will be delayed unless all papers are listed as complete. Complete is just another term for in compliance. If a paper is submitted for public access more than 3 months after publication, it will be considered non-compliant, even if it has been submitted, but it was submitted late. It will still be listed as non-compliant until it finally is assigned the PMCID number, and then it'll be listed as compliant at that point. So this is a really important point because this is the most common way for papers to become tagged as non-compliant. There's some other ways as well that we'll look at later, but this is the most common one, that the author missed that 3-month window. And if you miss that 3-month window, then you are stuck, because no matter what you do, even if you submit the paper, you're still going to be non-compliant, at least until down the road when it finally gets the PMCID number, then it'll be okay, but you're going to be in trouble for that period of time. So just to give you a summary of what we've looked at under this first topic of the introduction to the policy, we've introduced some key terms, the National Library of Medicine. We've introduced NCBI, the National Center for Biotechnology Information. We've talked about PubMed versus PubMed Central and not confusing those two. We've talked about the policy itself and the fact that it's a law that was passed by Congress in 2008. We've talked about the reasons for the policy, because the public has a right to see the results of the research that they have funded through their taxes. We've talked about the applicability, that it applies only to peer-reviewed papers that were published on or after April 7, 2008. And we've also discussed the fact that the annual renewal of your grant depends upon compliance. So it's very practical and very relevant for you to be informed on this topic and to know the ins and outs of it. So this is a good place to stop and ask if there are any questions about the policy in general before we move on to the next topic. Yes, Dr. Condon.
I have a couple of questions. One is, I'm not clear about the time frame. The law, when I read it, gives a 12-month period after.
Right. Yeah.
But then there's also in the other side, it mentions a 3 months.
3 months, right.
After.
Yeah.
What? How do
Yeah.
you explain
Okay,
that?
I'll explain that. So the 12-month period is saying that the paper has to be made public within 12 months. And the reason for that is that most of these papers are published by journals that receive their income and their money through the subscriptions. So they don't want the paper to be public right away. So they give a 12-month, what's called an embargo, which means that it's held up for 12 months. And then after 12 months, it can be public.
Okay.
The 3-month issue has to do with the author's responsibility of submitting the paper to what's called the NIH Manuscript Submission System. We'll get to that in a minute. That system is what it processes the paper to make it available on PubMed Central. So it takes time for NIH to convert the paper and get it ready. And you have 3 months to do that. Then once it's given to them, then they'll make it available within that 12-month period. So the 12-month period is when it's actually made public. The 3-month period is your job to submit it to them so that they can make it public. Yeah. Yes.
What happened with the PI that submits an application and it's not compliant according to this criteria?
Mm-hmm.
What will happen to this product?
That's a good question. It's probably up to NIH to decide, but what will likely happen is that it will probably be allowed to go through the peer review process and the study section, but then at the point when they say, I'm sorry, yeah. The question was, what happens if an investigator submits a grant proposal with non-compliant papers in the proposal? And the answer, I think, I'm not 100% sure on that, but I think the answer is that they will allow the proposal to go through the peer review process, but then if it gets awarded, the funding might be held up. They might issue the notice of award with a restriction on it saying that the funding will be delayed until the paper is in compliance. So,
Normally, in the review section, we normally
yeah,
go to PubMed and see whether there's like reading papers or not.
Right. right,
Like we don't care
Yeah.
about that.
right. That's not your concern, but it is NIH's concern, right? So, yes.
Is the same responsibility for a senior corresponding author as for the co-author? Let's say I collaborate with experts that receive funding from private or government,
Mm-hmm.
and they have not complied.
Yeah.
I am a co-author. What should I do?
Yeah, so you're responsible as well. Even if you're just a co-author and you're not the primary author, you're just a co-author, you will still be responsible because anytime you list that paper as a paper that you were an author of, you have to include the PMCID number as well. So what you should do is communicate with the corresponding author and make sure that they do it. If they still refuse and they're just very stubborn and won't do anything, you can do the steps that are needed to be done. There is a thing that allows you to go into the system and say, I want to take over responsibility and get it done. Yeah. We'll talk about that in a minute. So, yes.
I've also seen, maybe you're going to cover this later on, but I've seen authors' manuscripts on the systems. They seem to have been submitted by the author, not by the original, not by the journal.
Mm-hmm. Yeah.
How can you? There's the copyright issue.
Yeah.
Of the publisher, but then there's the need for the authors to be compliant.
Right.
What's the position of NIH about that? Or why should I do? Because sometimes you ask your co-authors, oh, no, you cannot do anything because you have to wait until the journal submits the paper.
Right. Right. Yeah. So we'll talk about that next. But basically, there's different methods. There's 4 different methods for getting a paper onto the system, and one of the methods is to let the journal do it. So, yes.
Just a curiosity, of those 800,000 people that use
PubMed, how many are U.S. citizens, or we're talking about all over the world?
That's a good question. I don't know the answer, but I'm assuming it's throughout the world. But what is the percentage of the breakdown? I don't know. You could go to the NIH Public Access website. They might have that information there. But yeah, it's publicly available to the world. Yeah. So that's a great benefit to all of all of society. So.
Yeah, because you mentioned that NIH used that number to look at what is the interest of the public in terms of ECCs. We should invest more money for funding for research. So if someone from other places, take more care about one disease versus the other one, probably NIH are distributing the money.
Yeah, that's a really interesting question. They don't really give that much data about the searches. This is it's kind of like Google, right? Like Google could, and sometimes they do give you information about these are the most popular search terms and so on, but really it's their proprietary information, and they're only going to release what they want. So NCBI probably can use that information. It's big data, and they could mine that data to find out what are the topics people are interested in, and what are the locations, the geographical locations of the people that are searching. But they don't really release, I haven't been able to find a full disclosure of all of that data. That'd be an interesting question to find out. Yeah, that's a good question. All right, let's move on then to the next topic, which is the author's responsibilities. And hopefully this will address some of the questions that have already been asked in more detail. So the author has 4 responsibilities. And by the author, I mean anyone who is an author, whether it's the corresponding author or a co-author. The first responsibility is to address copyright. I'll explain that in a minute. The second responsibility is to acknowledge the grant that funded that paper, or the grants, plural. Third, to deposit the paper in PubMed Central, or to make sure that it gets deposited somehow. So there's other ways of doing it besides the author. The journal can do it. And then fourth, to cite the paper correctly. So those are the 4 things you have to do. We'll talk about 1 and 2 very quickly. The third one is the most complicated one, and we'll spend more time on that. So first, address copyright. This is a very simple concept. The concept is that anyone who is a creator of intellectual property, and we're not just talking about scientists writing papers, we're talking about anybody, somebody who's making a movie or whatever, they own, according to copyright law, they own the right to the materials that they create. However, when someone wants to get their material published, they enter into an agreement with the publisher to transfer some or all of those rights to the publisher. So it's kind of like this interesting deal that you're making. On the one hand, you own the rights, but on the other hand, you want this intellectual property, this intellectual thing you've created, to be public, and you want it to be published by a reputable, established publisher. So to do that, you have to give up some of your rights. So the key is that before you sign an agreement with the publisher to transfer some of those rights to the publisher, you as an author need to work with the publisher to ensure that they will cooperate with the NIH public access policy. And this is kind of an area of trouble, because not all publishers are excited about this idea of public access. And you can see why, because it affects their own bottom line. It eats into their own revenue. That's why we have the 12-month embargo, because that helps to give them a chance to recover some revenue before it becomes public. So the key then is that authors should avoid signing any agreements with publishers that do not allow the author to comply with the NIH public access policy. You can see how this could be a problem. If you accidentally publish a paper with a publisher that says, we will not allow you to make this public, then what do? Now you're in trouble because you published it with them, but you cannot now be in compliance with the public access policy, and you're stuck. So you have to do your research before that. In other words, choose a journal wisely. Choose a journal that is willing to cooperate with the NIH public access policy.
So if that happens, then we could not include that article in the biography.
Right. Right. If it does happen, then more than likely what you will have to do is retract the paper from that publisher, because you have to be in compliance. Otherwise, your whole career is stalled. You won't get any funding. You won't be able to move forward. So the other possibility would be that you might be able to negotiate with the publisher after 12 months and say, will you allow me to make it public on PubMed? I'll do it. I'll put it up there. But they might be willing to negotiate with you after the fact. But it's something you have to be very careful about. You have to be very careful about which publishers you choose. So that's the first issue, addressing copyright. The second issue is acknowledging the grant. So, you know, in the scientific paper, at the very end, there's a section called acknowledgments. Well, not at the very end. I think that the very end is the footnotes. But just before that, before the endnotes, it says acknowledgments. And you have to make sure that you acknowledge the grant or grants, plural, that supported the research in that paper. And this is the language that you're supposed to use. You say, research reported in this publication was supported by, I'm giving you an example from one grant, by the National Institute on Minority Health and Health Disparities of the National Institutes of Health under award number U54 space MD 008149. And notice the space after the activity code. It's important to put that space because how do these numbers get into the system? Well, there are computers that crawl through all the data and look for these numbers, and when they find a number that looks like it's a grant number, they automatically harvest that number and put it into the database. And so one of the things that helps the computers to know that it's a grant number is the activity code followed by a space followed by the rest of the grant number. Now, if you forget to do that, if you don't put a space there, it's not that all is lost. There is a way after the fact to make sure that the paper gets linked to that grant. But it does help if you do it right the first time. This has happened before, too, where sometimes authors made a mistake. The grant number was off by 1 or 2 characters. And when that happens, it can really wreak havoc in the system. And it's not a good idea. So make sure you get those numbers correct. Let me give you an example of what it looks like. So you know that the first 3 digits of the code are called the activity code. The activity code is referring to the type of grant. So if it's an R01 or an R21 or a U54, which is a cooperative agreement, these are all different types of grants. Sometimes there's also a number before that which refers to the application type. So 1 would be an initial proposal. 5 would be, that's the code for non-competing progress report, the type 5 proposal. That initial number you can leave off. You don't need to include that. The important number is the activity code. Then after the space, there's the institute or center. So NIH has all these institutes, right? The National Cancer Institute, the National Institute on Minority Health and Health Disparities, and so on. Each institute has a 2-letter code to identify which institute is doing the funding. So MD is the code for NIMHD. Then after the center code, then you have the serial number, which is just a 6-digit number that identifies that grant. So those are the sections you need to include: the activity code, the center code, and the serial number. Any numbers after that are not relevant because those are things like the year of the funding, year 1, year 2, or perhaps a supplement, S1, S2, that kind of thing. You can leave those off. What you need is the numbers in the middle there. So make sure you acknowledge the grant in your papers. That's very, very important. Now the third responsibility of the author is to deposit the paper in PubMed Central. So there are 2 primary methods for getting a paper into PMC. The first method we'll call method AB because there's actually each one has a subdivision, but we'll just say method A/B is the first general method. It's called direct deposit. So this is similar to, you know how with your payroll check, you can sometimes get direct deposit where it goes right into your bank. You don't have to get the paper check and then endorse it and then take it to the bank. It just goes in there directly. Same thing with these papers. One way that papers can get into PubMed Central is called direct deposit, where the journal is responsible for this work. The journal is the one that will convert the paper into the proper format for PubMed Central, and the journal is the one that will go and deposit the paper into PubMed Central. They actually have a back door into the system electronically where they can just put these things in directly. So method A/B is direct deposit. The second method, method C/D, is through what's called the NIH Manuscript Submission System. The NIH Manuscript Submission System is a processing center that allows the author or the journal to submit the paper to them so that they will process the paper and convert them into the right format. So NIH does the work. NIH will take the paper and convert it, and NIH will put it into PubMed Central. So these two main methods, direct deposit and the NIH Manuscript Submission System, you need to keep those two things in mind as a general principle of how to get papers in there. And each of these two will then subdivide into A and B and C and D, and we'll explain what the subdivision is in a moment. The key thing to understand is that before a paper can be deposited into PubMed Central, the paper has to undergo an indexing and formatting process to make it ready. And just think of all the things that have to be done to make a paper ready for PubMed Central. The first thing that has to be done is they have to assign the unique identifier to that paper. That's the PMCID number. Another thing that they need to do is they need to add what's called metadata. Does everybody know what metadata is? So the paper itself is the data, the text of the paper, but the metadata is information about that data, information about the paper. So what are some of the metadata that you would want to see about a paper? Well, you'd want to know who the authors are, you would want to know the journal, the volume number, the year, the page numbers, you want to know the grant numbers that are associated. These are all metadata that have to be attached to the paper. In addition, they need to index the paper using medical ontology. So indexing is very important because that's how people, when they go into search, when they're searching for key terms, whether it's diabetes or West Nile virus, they will use those key terms to pull up all the papers that have those terms in them. So they have to index the paper to make sure those key terms are there. They also have to format the tables, the figures, and the images into an electronic version that can be read on the internet. And they have to convert the paper into a readable format for XML, for internet, but also using mobile devices. So they have a system called PubReader, which allows people to read these papers on their tablet, like an iPad, or even on their cell phone. So all this process of doing this work, this takes a lot of work. It's very labor intensive. Some of it is even manual in a sense. You have to do it by hand to some degree. And so it takes a while for a paper to be converted into the PMC format. So let's go back then to these two methods. Now we're going to break them down into the two sub-methods of each method. So the first method, direct deposit, has two sub-methods, method A and method B. Method A journals will do everything for you, and you as the author don't need to do a thing. Okay, these are the best ones, right? No author involvement, it's taken care of for you. The journal converts the paper into PMC format, and the journal deposits the paper into PMC directly. They have a back door into the system, and they just shovel all the papers in directly into PMC for you. Method B is called select deposit. These are journals that will not automatically deposit all their papers into PubMed Central because they want to get paid. So they require the author to pay an open access fee first before they do this. But once you pay the fee, then they go ahead and convert it, and they go ahead and stick it in to PubMed Central for you. Usually these open access fees are around $2,500. That's an average ballpark figure. They can vary from journal to journal, but that's a good estimate. So method A and B, A, they do it for you. B, you have to pay. Now, method C and D is the same thing. So method C journals, these are, but we're using the NIHMS system now. These are journals where the author has to go into the NIHMS system and submit the paper there. Then NIH will prepare the PMC-Ready version. Then after they've done that, they send an email back to the author and they say, okay, your paper has been formatted. Please log in and check it to make sure it's okay. Once you hit approve, then they submit it to PubMed Central. Method D journals are similar to Method B journals in the sense that the only difference is now you have to pay a fee. So the author pays the open access fee, then the journal will submit the paper to the NIHMS system, and then it takes on from there. So Method A and B is direct deposit. Method C and D is using this intermediate step called the NIHMS system. Does that make sense? Yes.
Some faculty very receiving this method B.
E.
The reason is because we have, say, the minority setup where money is really very scarce. Investigators contracted with an idea.
Right.
Like, suppose if he or she publishes 2 papers a year and writes 3 years, so you're putting already 30, 40,000, right? $5,000 a year
Mm-hmm.
sometimes 30,000. So in a way, NIH should be doing something about that.
Mm-hmm. Yeah.
Because
Well,
it's not so obvious that in order, first of all, it's difficult to publish on the internet. An investigator with limited resources has a problem.
Right.
In order to be compliant, NIH should facilitate somehow. That would be my point.
Yeah.
Several people. We have to give them means somehow. I don't think it's a fair game for people who don't have so much money or so much resources.
well, they do allow you to charge those fees to the grant. It's an allowable cost.
You
So,
have less money for supplies.
right.
Then, or to hire people.
Yeah.
The grants are already getting taxed.
Yeah.
And now to get another 26% bid. So
Yeah.
it is something that I think you guys should be thinking.
Mm-hmm.
That's my suggestion.
Yeah. Yeah. So just make sure that if you're thinking ahead as a PI, make sure that you budget for the open access fee if you're planning to publish in a journal that requires that. So, yeah.
That is limiting.
Yeah.
Scarce resources.
Yeah.
You have limited resources you have for doing your work.
Yeah.
It adds an spot.
It does. Right.
So perhaps they could essentially think about how we could help investigators in different settings
Mm-hmm.
to be able to comply, because given the limited resources, now you add some more laws to be compliant.
Yeah.
You should be a facilitator to help comply.
Yeah.
And it's better to have money to do an experiment than to pay a journal.
And the other option, of course, is to find a journal that is either Method A or Method C, so that you don't have to pay the fee.
But sometimes
So
the problem is that you can find a journal that you like to have your publication,
right.
because it's a good impact.
Right.
And somehow the paper started gets rejected, so you need that PMC.
Right.
Sometimes you end up paying for your publication.
Mm-hmm.
So in a way, my message to you, and I have another one, so will be perhaps to think in terms of how NIH could help.
Mm-hmm.
This,
Okay. Right.
Perhaps spread the word or something, because that can really help.
Yeah. Okay. Let's move on then to the next section here. So let me just give you an overview of method A, B, C, and D using this table that shows the roles of the journal and the role of the author for each method. So under method A, the responsibility of the journal is to deposit the paper in PubMed Central, and the responsibility or the role of the author is nothing. You don't need to do anything for method A. For method B, the role of the journal is the same. It's also to deposit the paper in PubMed Central, but the role of the author is to pay the fee. And that's what will trigger the journal to know that they need to put the paper in PubMed Central. If you don't pay the fee, they won't do it. So you have they're waiting for you to contact them and take the initiative. For method C journals, it doesn't apply because these are journals that basically are not participating at all in this process. Method C journals are just journals that are saying, we don't know anything about this public access. You're on your own, right? So the authors are doing everything. The authors are the one who have to submit the paper to NIHMS. The authors are the one that have to approve the paper. And I put a footnote there because technically the approval happens by what's called the review author. Now it could be the same person as the author, but when you go into the NIHMS system, there's a section where you have to identify who is going to be the review author. That is, who is going to be the one to receive the email from the NIH system to say that the paper is ready for approval. And then under method D, the journal's responsibility is to submit the paper to NIHMS rather than the author doing it. But the author still has two things that they need to do. One is to pay the fee, and the other is to approve the paper when it's ready. Yes?
So, again, following the question of Adelpha, what happens if you collaborate with someone from Australia?
Yeah.
And that person is the main author, the corresponding author. And even that you talk with that person isn't here.
Right.
I mean, they're going to do what?
So it is allowable for you to do it. You can take over the responsibility and
We will
Yeah.
have to pay.
well, it depends on if it's method C, no. But if it's method D, then someone has to pay, whether it's you or your collaborator, but someone will have to pay. Yeah. So
But we will do it.
but you can do it yourself. Yeah. So let's talk about this NIH manuscript submission system. This NIH manuscript submission system only applies to method C and D, and it allows you to submit an electronic version of your peer-reviewed final manuscript for inclusion in PubMed Central. The authors can log into the NIHMS using their ERA Commons login, and after the paper is submitted, NIH will convert the paper into PMC-Ready format. 6 to 8 weeks later, after you've submitted the paper, and once they've finished converting the paper into PubMed format, then NIHMS will send an email notification to the review author. Now they say on their website that it only takes 6 to 8 weeks, but in reality it sometimes takes longer than that because they're backlogged with thousands of papers that they have to do. But their goal is to make it a 6 to 8 week process. So then at that point, once the email notification has been sent, the review author is required to log back in to the same NIHMS system and to review it, make sure everything looks right, make sure the tables are correct, the figures are correct, and then hit approve. And then once it's approved, it will then be sent to the PubMed Central. This is another way that papers can be stalled. So the first way you can have a problem is if the author forgets to upload the paper in the first place and misses that 3-month window. The other way they can get stalled and become non-compliant is if the review author forgets to respond. Or maybe the review author didn't know that they were a review author. Or maybe the email came but it was sent to their spam filter. So there's different ways you can have a problem here. So it's important for the review author to know that they've been asked to do this job, and it's important for them to be tracking it and to be checking to make sure that they don't miss this stage. Some links for how to use the NIHMS system. The main website is given there at the top. The best place to go is this bottom link here, where it's a slideshow that takes you step by step through the process, from the login to uploading the paper. You have to upload the text of the paper, then you have to also upload the figures as separate files. You have to select the grant or grants, plural, that are being funded, that funded this paper. So there's some different things you have to fill out, but it's very easy to use. At first it might be intimidating, but it's not that hard at all. It only takes 5 minutes to upload your paper. And that slideshow will show you how to do it. There's also this FAQ page. This particular page is very helpful because it answers the question that you had about what do you do if the primary author is not doing their job? How can you take over? It tells you how to do that. So the ultimate goal is to have your NIH-supported papers published on PubMed Central, thereby fulfilling the public access mandate. And so I've given you an example here. I went into PubMed and I searched for the G12 grant here at the University of Puerto Rico Medical Sciences campus, and I found a paper published by one of your faculty members. And this is the paper. This is what it looks like when it comes up under PubMed, not PubMed Central, just PubMed. There's the title of the paper and the authors listed there. There's the abstract. But notice over here you have this icon that says PMC, free, full text. So this tells you then that they have done their job. The paper is now available on PubMed Central. And you click on that icon and you can read the paper. There it is. This is the whole text of the paper. You can scroll down and read it all. And you can also download it as a PDF. Now, not all papers are published as PDFs because it depends on the publisher. Some publishers don't want it to be available so easily, where you can print out the whole thing on your own computer. But many of them do allow that. Some of them make it harder. We have to click page by page. So it sort of makes it a little bit, it provides a little bit of control and allows the journal to feel that they're still getting their money's worth out of this paper. There's also the Pub Reader. That's the one I mentioned before that you can use to read on your tablet or your iPhone. So this is how it works, and it's a great service to the public, and it's just a wonderful thing to be able to so easily see the papers like that. So reviewing then the author's responsibilities, the author has 4 things that they need to do. One is to address copyright, in other words, make sure that the journal will cooperate with this policy. Second, to acknowledge the grant at the acknowledgement section of the paper, listing off the grant and the grant number. Third, to deposit or see to it that it gets deposited in PubMed Central. And then the 4th responsibility, which we're going to deal with now, is to cite the paper correctly. So when citing a paper in your proposals, in your biosketches, and in your progress reports, you always have to include the PMCID number at the end of the full citation. This requirement only, again, applies to the papers that fall under the applicability. So peer-reviewed, not letters to the editor, and published on or after April 7, 2008. And third, published or supported by a grant. To give you an example of what it looks like, you just have this example at the bottom here. You have the authors, the title of the paper, the journal, and then at the very end you write PMCID : PMC, and then the number. You have to put all of that in there. The part where it says PMC is part of the number. So PMC 243493, that's the whole PMCID number. And it's important to highlight it in bold because when program staff at NIH are reading your proposal or reading your biosketch, their eye is going to go right to that PMCID number, and they'll see it in bold. And in my opinion, some authors like to include the PMID number, but in my opinion, it's not relevant. You can just leave that off if you want to. It might be useful for the reviewers in the study section, but it's not directly relevant for NIH. Now, what do you do if you have a paper that has not yet been assigned a PMCID number? So how do you cite papers that are called in process? It's been published, but it's in process in terms of getting the PMC. So there's two ways you cite those depending on the journal. So if you're publishing this paper in a method A or B journal, then what you write is PMC journal dash in process. I've given you an example there. If the paper is published in a method C or D journal, then you use the NIHMSID number. So you say NIHMSID colon NIHMS and the 5-digit code. Let's just give a little bit of background here on these two numbers. There's actually three if you include PMID, but the two that are important for the public access policy are the PMCID number and the NIHMSID number. So first, the PMCID number. PMCID stands for PubMed Central ID. It's used for all papers regardless of the journal type. So method A, B, C, or D journals, it doesn't matter. They all need to have PMCID numbers. For papers published in method A or B journals, those are the direct deposit ones, the PMCID numbers are assigned around the time that the paper is published by the journal. For papers published in method C or D journals, the PMCID numbers are assigned later. They're assigned after NIHMS has prepared the PMC-Ready manuscript. So let's say it gets published in January, you submit the paper to NIHMS in January, and then about 2 or 3 months later, they send you the notice and you approve the paper. Then that's when it'll get the PMCID number. And then, before the 12-month period is over, it'll be available on PubMed Central. Now, the NIHMSID number is a different number. It stands for the NIH Manuscript System ID. It is only used for method C and D. So method A and B papers don't have NIHMSID numbers. Only method C and D papers do. A paper with an NIHMSID number indicates that it has been submitted to the NIH Manuscript System. Papers using method C and D will start out having only the NIHMSID number, and then later they'll be assigned the PMCID number. Once a PMCID number has been assigned, you should cite that number, not the NIHMSID number. So the NIHMSID number is a temporary number that just indicates that it's in process. Papers submitted to NIHMS more than 3 months after publication will be non-compliant until PMCID numbers are assigned. So that's a very important thing to keep in mind, because you will be out of compliance even if you have submitted the paper, but if you submitted it late, you will still be out of compliance. Here's a really helpful link that I recommend you all use. This is called the PMCID/PMID/NIHMSID converter. So this is a great thing because you might only know one of the numbers, and then you can get the other two numbers from this. Or you can find out that it doesn't have the other two numbers, and then you know you're in trouble, right? So let's say all you have is the PMID number. That's just the citation and the abstract. But you don't know if it's compliant yet. Maybe you're one of these collaborator authors, co-authors, and you want to know, hey, has my main author submitted the paper to NIHMS yet? Well, you can just type in the PMID number and find out. And it'll pop up and say, here's the number. Or it'll be blank. And then you say, okay, I got to call my friend and tell him to do his job. So it's a very helpful tool to use this converter. You can go back and forth between any direction. If you have any one of those numbers, you can get the other two through this. You can also put in multiple numbers and only separate them by a comma. So if you have a whole list of 5 papers, just stick them all in there and separate by commas, and it'll spew out the report as a nice table with all of the matrix of the numbers listed. So to summarize then, for the author's responsibilities, make sure you select your journal wisely. Determine the method that that journal is using before you submit it for publication. That way you'll know what your responsibilities are even before you get started. Acknowledge the grant using the correct language and grant number. Ensure that your papers are deposited to the system using one of the 4 methods. For Method C journals, learn how to upload a paper to the NIH Manuscript Submission System. Be prepared for the email notification 6 to 8 weeks later. In biosketches, proposals, and progress reports, always include the PMCID number with the citations. And then finally, know how to cite papers that are in process. So any questions about the author's responsibilities? Yes?
What happens if the journal uses method A or B? You pay and everything's supposed to be running, but the journal takes too much time, and you are afraid that it might not comply.
Yeah.
Should we go ahead and submit on our own, or are we violating copyright?
Right, that's a good question. So is it allowable to use the NIHMS system yourself, even if the journal supposedly is going to do it? That's a very good question. In my experience, it is there are cases where that can happen. But you need to talk to the journal about it first and make sure that they're not upset with you. But I have heard of that happening. So you thought it was going to be done through method A, and they just didn't do it. It's taking too long. Go ahead and try through the NIHMS system and see what happens. But you need to communicate with the journal first. So. All right, shall we take a 5-minute break and come back? Okay, let's go ahead and get started. Okay, so let's review the topics that we've covered so far and the topics to come. We've looked at the introduction to the NIH Public Access Policy. We've covered the author's responsibilities. Now the topics remaining are the PI's responsibilities, and this also includes the PI's staff, troubleshooting non-compliant papers, and strategies for enhancing compliance. So let's look then at the PI's responsibilities. The principal investigator is responsible to ensure that all papers supported by their grant are in compliance with the NIH Public Access Policy. And this is true even if the PI is not an author or a co-author of the paper. Now at first that might seem a little bit counterintuitive, but it makes sense. Let me explain why. For example, if you have a large center grant, like the G12 program here, the PI, Dr. Fernandez-Repollet, she may not be the author of every single paper that is supported by that grant. But all of the PI, all of the faculty members that are part of that program and that publish papers supported by the G12 program, they are responsible to make sure that they cite the grant and that they get the PubMed Central compliance taken care of. And the PI is responsible to watch over that process and to encourage the faculty members and to encourage all of the authors to follow that. The PI must therefore be proactive in planning, communicating, and training and monitoring all publications, if possible, even before they are published. So it's helpful if the PI is aware that so-and-so is about ready to submit a paper. That way the PI can be in communication with the author and help the author to make sure that they're following all the procedures. One of the important things that PIs need to do is to log into what's called My NCBI. So under NCBI, there is this place where you can log in order to access your own version of NCBI as a principal investigator. You use the same ERA login that you would use for finding your notice of award. The PI can also delegate staff people to log in for them. There's a section in My NCBI where that's given as a possibility. The PI or the staff, when they log in, they need to, one of the main things they need to do is to make sure that all the papers supported by the grant are linked to the grant. So as I mentioned before, that if an author forgot to acknowledge the grant in the paper, or if they didn't use the exact format correctly, the PI can still manually link the paper to the grant. So that's a very helpful thing to know. So all is not lost if you forgot to cite the grant. There's still a way to do it. Now, one of the most important things that a PI does is to prepare and submit the annual non-competing progress report. And to do that, you need to create a publication report for the progress report. And there are two methods of doing that, depending on your way of submitting the progress report, whether it's by paper or electronic. So if you're submitting your progress report by paper using the 2590 form, you need to have a manually generated PDF report of all of the publications supported by that grant. If you're doing it through the RPPR method, the electronic progress report, that is taken care of for you because RPPR automatically goes into the PI's MyNCBI and takes all those papers and pre-populates them into the RPPR. And all the PI needs to do is just to check them and make sure it's correct. How many of you here use RPPR for progress reports? How many use paper, 2590? Seems like there's not much paper left, mostly RPPR, right? So RPPR is easier, it's not as much work for you, but I'm going to go ahead and give you the step-by-step for doing the paper method because even though it's different, the first 5 steps are the same for electronic. So, how do you log into MyNCBI? Well, you go to NCBI, and there's a link at the very top right-hand corner saying sign into MyNCBI. You go there, and this is what comes up. This is what MyNCBI looks like for each PI. So you see the section there on the right, the second box called Collections. And then the second link down is called My Bibliography. That is the most important section of MyNCBI that you as a PI need to be aware of. That's the key, My Bibliography. This section over here is also the same thing, the big section, My Bibliography, except this one here has some warning signs at the beginning saying, letting you know that some of your papers are not in compliance with public access. Look at number 2, the second link. 5 of your citations in My Bibliography are not compliant with NIHPA. So that gives you a warning right there. You can click on that link and see what those 5 papers are, and you can begin the process of calling up the author and saying you need to do the work to get these papers in compliance. How many of you here have used MyNCBI? You've all used it. Good. Okay. So you know what I'm talking about. The public access status codes are very useful. They use 5 different codes. Red means that it's out of compliance. Yellow means that it's in process, so it's been submitted to the NIHMS system, and it has an NIHMS number, but it's not yet it hasn't yet been submitted to PubMed Central. Green means you're good to go. The paper is compliant. NA means that it's not applicable. So this would be either because it was before 2008 or because it was not a peer-reviewed paper. Maybe it was a letter to the editor. And then the question mark means that NIH cannot identify the grant that was supporting that paper. Maybe the author forgot to acknowledge the grant. There's just no information. So that means you as the PI have to go into that paper and link it to your grant and say, okay, here's the grant or grants that supported that paper. If the author forgot to acknowledge, or if they didn't use the right format so that the computers couldn't read it, there's some question about they couldn't tell what grants are supporting that paper.
Let me make sure. So if you are an author and the author who submitted the paper forgot to acknowledge the grant,
yeah, you can go in and do it. Yeah, yeah, you can link it yourself. So I'm going to give you the step-by-step instructions for generating the PDF publications report for the paper, and the first 5 steps of this are the same for electronic progress reports, so you should still listen to this. So you start in by logging into my NCBI as the PI. Then you go back to PubMed. So PubMed, you don't have to log in to do PubMed. PubMed is just a completely free thing. Anybody could do it. But you need to make sure that before you go to PubMed, you log in as the PI, because that way you'll be able to take those papers that you find from PubMed and transfer them to your bibliography. So make sure you're searching PubMed rather than PubMed Central when you do this, and I'll show you what it looks like. So when you go to PubMed, there's a drop-down menu where it says Resources. You click on Resources. Make sure that you select the top one, which is PubMed. If you select PubMed Central, PMC, then there's no point in doing that because you're already searching papers that are already compliant. So what you want to do is search PubMed. That way you'll find papers that may not be compliant yet. So what I recommend is that you, let's say you're a PI of a grant, you have your own R01 or R21 or K or whatever, just type in the grant number. Leave out the activity code. So leave out U54, R21. Just type in MD 008149 or whatever the grant number is. Type that into the search field. And then you'll get a result list of all the papers that cite your grant, that acknowledge your grant. The next step is to select, using this check mark here, select each paper that you recognize that you think should be included in your bibliography. Then you go to the link there at the top where it says Send To. See it up there? Send To, and then click the dot that says My Bibliography. And then they just ask you to confirm it and save it. And once you do that, then you go back to my NCBI, and all those papers that you just brought in will now be added to your bibliography.
Could you go back a couple of slides?
Yeah. Here?
Yes.
Can I download those issues and use with softwares like EndNote?
I believe so, yeah. Yeah, there's another, see where it says choose destination? So you can choose a file. You could create just a Word document that lists all those, or you can also go to Clipboard. It allows you to cut and paste. You can send it to email, and so on. So, yeah. So now you're back in my NCBI. You were in PubMed. Now you're back in my NCBI. Now you go to My Bibliography. So this is My Bibliography. This has all the papers that you have now brought in from PubMed to say these are my papers. These are in my bibliography. Now these don't have to be, it's important to understand that in my bibliography you can have other papers as well, right? Maybe you're doing some research on some topic and you just want to have those papers in your bibliography for reference. You can have those in there as well. Because the nice thing is that you can search and filter your bibliography depending on what it is that you're trying to do. So if you want to create the publication report for your progress report, you can search within your bibliography just for those papers. So there's the section over here on the right that says filter citations by. So what you do there is, if you're going to create your progress report, now here we're talking about the paper using the PDF system, you put in the publication dates that you want. So you're reporting on the previous year, so you put in the dates for that previous year, and then you select the grants. So see where it says awards, and there's a whole list of all the awards that you're the PI of, and you look for each grant number and you select it. And often you'll notice that sometimes there's more than one entry for the same grant. Why? Because of all those other numbers, remember? There's the 1s and the 5s in the beginning, and there's the year at the end. So they might have 3 or 4 different boxes there that are all the same grant. So you have to make sure you select each one. So you put in the dates, you select all the grant numbers, then you go to the bottom where it says Apply Filter, and that gives you the result. And then you select the publications you want to include in your report by clicking those boxes again. And then you create the PDF report. There's the link at the top where it says PDF report, kind of in the gray box. You select that, and you have to type in the PI's first name, the PI's middle name, the PI's last name, and the page number, because when you're doing the paper version of the progress report, the 2590, the publication report has to be inserted right before the checklist. So you look at you go to your Word document, you find out what the page number should be, you type in the first page number, it'll automatically add 101, 102, depending on how long it is. Then you select Download PDF, save it to your hard drive, and this is what it looks like. So here is a sample PDF publication report that lists off all the papers that are cited, that are supported by that grant for that grant period. And on the left-hand column, it tells you the status of that paper in regards to public access. And there'll be three different possibilities. One is complete, which means it's compliant. It's green, you're fine. The other thing it could say is in process, which means that it's one of those papers that's in the NIHMS system but hasn't yet been put on PubMed Central. Those are okay as well. Or it might say non-compliant. Those are the ones that are problematic. Those are the ones where it was either submitted after the 3-month window or it was never submitted at all. Those are the ones that NIH is going to tag you for, and they'll hold up funding if they see any of those. So then you insert this PDF into your progress report for the 2590. That's for the paper. If you're doing electronic through the RPPR, the RPPR requires grantees to report publications using an ERA Commons linked MyNCBI account. The RPPR publication section, section C.1, is pre-populated with publications from the PI's My Bibliography in MyNCBI. So that's why I said, even though I was giving you the instructions for doing it through the paper system, the first 5 steps are the same. Going in, logging in as MyNCBI, then going to PubMed, and bringing in those papers into your bibliography. Non-compliant publications in the RPPR method, we're talking about the electronic progress report. Submitting an RPPR with one or more non-compliant publications will generate an automated email notifying the PI that there are non-compliant papers. The PI must then respond at least 2 weeks prior to the next budget start date. And the PI can respond in one of 2 ways, either via email, responding to that email, or through the Progress Report Additional Materials link, the PRAM. The receipt of the Notice of Grant Award will be delayed until the PI shows evidence of compliance or provides a good explanation. Now, what's a good explanation? The only good explanation is the author died. We couldn't get it done in time. Something like that. It's up to the program official to determine whether the explanation is good enough. For some training on how to use MyNCBI, there's a helpful list of resources at the Public Access website. NCBI also has a couple of training videos on YouTube that you can look at. The best place to go is the last link at the bottom, which has step-by-step screenshots of every single page showing you what to do for each thing. So I highly recommend that you check those out. So the PI's responsibilities then is to work with authors to ensure that all peer-reviewed papers supported by your grant are submitted to PubMed Central using one of the 4 methods. If method C or D, to remind authors that they will also need to approve the PMC-Ready manuscript. Don't forget that step. It often gets missed. Wait for that email 6 to 8 weeks later. Go in and approve it. The PI should also train authors, should train collaborators, program managers, staff on all of these issues. My NCBI, for example, it is not just the PI. The PI staff can also be delegated to go in and continually check the bibliography, make sure it's up to date. Continually check to see if there's any red papers that have a red dot. Those are ones that are warning you. You need to do something here. To check PubMed throughout the year for new papers that come into the system and to see if they are in compliance. Don't wait until the progress report is due, because you won't have enough time to get the papers in compliance. It takes time to go through this process of getting them ready. So to summarize, the PIs and their staff must learn how to use My NCBI now. My NCBI is absolutely critical. And if you don't have an account, then set one up today. And don't forget your password. Of course, that's tough these days, right? Because we have so many passwords for so many things, but it's important to keep track of it. Learn how to link papers to the grant. Learn how to generate the PDF publication report, or if you're doing the RPPR, learn how to keep your My Bibliography up to date. Be proactive to avoid non-compliant papers. You don't want to be caught at the last minute. So any questions about the PI's responsibilities then? All right, let's move on then to section D on troubleshooting. So this section here is very helpful and very practical. Probably one of the most important questions you're having right now is that you want to know, how do I know which of the 3 or 4 methods I should use? Or how do I know if I have a certain journal in front of me, you know, Lancet or Cell or JAMA, how do I know which of the 4 methods it belongs to? So under this section here, I'll explain how to do that. So I'm going to tell you how to determine the journal type. You can tell whether it's A, B, C, or D. The next step you should do after you determine the journal type is to determine where the breakdown happened. What was the problem that caused this paper to become non-compliant? The third step is to identify the author or an author. When you're looking at the list of authors, try to pick an author there that you think you know and that you can communicate with. Fourth, communicate what needs to be done to that person. And then 5, follow up regularly with that author and also with My NCBI, because they have some things to do as well. So let's first start with determining the journal type. So the best way to determine whether a journal is method A, B, or C, or D is to go to the website of the journal. The journal itself has a website, and they usually have very helpful information there. One thing that they can tell you can find out from the website is who is the publisher of that journal. Often that information will be at the very bottom of the website. It'll say, this journal, Lancet, is a publication of Elsevier. When you see Elsevier, write that down, because now you know a very important piece of information. You'll know that that paper is going to require an open access fee. It's going to be method B or D. Almost all Elsevier paper journals and all Springer journals are going to require that fee. Elsevier and Springer are the publishers of the majority of journals. Probably 80% of journals are published by those 2 companies. They publish thousands and thousands of journals. So it's important to know the publisher, because some of the lists that we're going to look at are lists of publishers, not lists of journals. The other place to go on the website of the journal is to go to the section called Instructions for Authors, because in that section there will be a paragraph titled Open Access or Public Access, and it will tell you, yes, we have a fee, or we don't have a fee, we automatically do it. You'll be able to determine the method based on that. The next place to go, after you've gone to the website of the journal, the next place to go is to some links that I'm going to give you in a minute that have lists of all these methods. NIH provides these lists that they update regularly. Before we do that, though, just a reminder of the difference between a journal and a publisher. A journal is a specific peer-reviewed scientific periodical. For example, the Journal of the American Medical Association, JAMA, that's one particular journal. A publisher is a company or an organization that publishes multiple journals. So not just Elsevier and Springer. There's also other organizations like the American Academy of Cancer Research. They publish 7 or 8 different journals because they're all related to cancer research. So you need to know who the publisher is. So here is a link that provides a list of all Method A journals. And it just lists them off alphabetically. So the first column here is the title of the journal. The next column is the abbreviation that's used for that journal. And then if you go to the last 2 columns, they have start date and end date. Those are the dates when the journal began to participate in this process of submitting their papers to PubMed Central. Sometimes they have an end date, which means that they only participated for a short time, and then after a while they said, forget it, we don't like this, it's too much work. So there was a time when they were doing it, and then they changed. And so you need to know that fact of if they decided to drop out of the program, because then that means, okay, now I have to go to Method C for that journal. The next link here is a list of all Method B publishers, not journals, publishers. So instead of giving you a list of Method B journals, they give you a list of Method B publishers. That's why I said you need to go to the website and find out who the publisher is. So these are all what are called select deposit. That means that they do participate in PubMed Central. They do send the papers in, but only on a select basis because they're waiting for you to pay the open access fee before they do it. There's another link as well. This is a link through NCBI. So those other links were on the public access page of NIH, but this link here is on NCBI. This one is probably the best place to go because this provides a comprehensive list of all journals that deposit papers directly to PubMed Central. So this will include both Method A and Method B. And in this list, they will use certain words. They won't say Method A or Method B. They'll use different terminology in this list. They'll say full participation, or they might say it's NIH portfolio, or they might say it's select deposit. These are just different code words to refer to Method A and B. This list is more detailed because it lists all journals, not just publishers. But it does not include Method C and D. There are different degrees of participation in PubMed Central in this list. One degree of participation is called full participation. That means that these are Method A journals that deposit in PubMed Central all articles from each issue of the journal. They participate fully. There are other Method A journals, though, that participate less fully, and they participate according to what's called the NIH portfolio method. That means that they deposit only the NIH-funded papers. So full participation, they put every paper in there. NIH portfolio journals will only put in the NIH papers into PubMed Central. But it's still Method A. So these are both Method A journals, but they just have different degrees of participation in PubMed Central. The term select only means that these are Method B journals that have opted for a selective deposit model pending receipt of the open access fee. And then no longer participating, as I mentioned before, these are journals that used to deposit and then they stopped depositing, but the papers that they did deposit in the past are still there in PubMed Central. They don't take them back. So when you go to that link that I gave you before on the NCBI page, they don't say Method A or Method B. Instead, they use these 4 terms. So you have to know how to translate what those terms mean. If you see it where it says this is a NIH portfolio journal, what does that mean to you? That means Method A. If you see that it says select only, what does that mean to you? That means Method B. So you have to translate the terminology. And then there's a list of Method D publishers. So these are Method D, that is, they're using the NIH system. They're not going directly through the back door into PubMed Central, but they require an access fee to do that. So if you want the journal to submit this paper to the NIHMS system, you have to pay them to do that. If you don't want to pay them and you want to do it yourself, then you would use Method C. So these are Method D publishers. Again, they're publishers, not journals. And each of these publishers has a whole list of journals that they publish. And Elsevier and Springer, which are the two biggest publishers, are on this list, Method D. Now what about Method C? Well, there is no list of Method C. It's just process of elimination. So if the journal is not found in the PMC list of Method A and B journals, and if the journal's publisher is not found in the list of Method D publishers, then by process of elimination, you know it must be a Method C journal. So that series of slides that I just went through is very important because it has the links that you need to check and the process that you need to go through mentally. It's almost like doing detective work, you know, because you have to piece things together based on different pieces of information, based on the publisher, based on these lists, and then after a while you'll be able to determine from this process of investigation what you need to do and where the problem might have occurred. So the next step then is just that, to determine where did the breakdown occur. Did the author fail to pay the open access fee for a Method B journal? Or did the author or the journal fail to submit the paper to the NIHMS system for a Method C or Method D journal? Did the reviewing author fail to approve the PMC-Ready manuscript? That could be the issue where the problem happened. Or perhaps everything has been done on our part. We've done all that we can, but the problem is with NIHMS. They still have a whole backlog of papers. Your paper is at the bottom of the pile, and they just haven't gotten to it yet. That could be the problem. And in that case, then, you need to contact them and ask them to work on it. So the first step is to figure out if it's Method A, B, C, or D. The second step is to find out where the breakdown happened. The third step is to identify an author in the list of authors of that paper. Look at the list of authors on PubMed and look for a name that you recognize. Just go through the list and say, oh, I know that person. That's a person right here at the Medical Sciences campus. I know who they are. I'll call them up. If you don't recognize any names, then look at the grant number and see if you can identify the PI. You can figure that out through NIH Reporter. Just type in the grant number and find out who the PI is, and then you can call the PI and ask them, do you recognize any of these authors? The next step after you identify an author that you can work with is to communicate with that author and just politely say, this is what needs to be done. The issue was, you forgot to pay the fee. You didn't realize it was a Method B journal or Method D journal. Here's the fee. Or if you don't want to do that, you can use the Method C and submit it to NIHMS. If the author doesn't respond, you could try another author on the list who might be more responsive to you. If the author is not the corresponding author, he or she can take over responsibility for that paper. So in the NIHMS system, there is a way to do that, where you can say, look, the main author, the corresponding author is just not responsive. They don't care. They're not answering my emails. I have to get this paper in compliance because my progress report is due, so then I'm going to take over this paper and do it. And NIHMS recognizes that and allows you to do that. If no authors respond, you can communicate with the PI of the grants acknowledged in the paper, and maybe that will put some pressure on one of the authors. And then the last step in troubleshooting is regular follow-up. Follow up with the author, asking if they've been able to do what is needed. Offer to help them if they're hitting any roadblocks. Maybe they don't know how to use the NIHMS system. For papers that have been submitted to the NIHMS system, but they're just backlogged and your paper is at the bottom, the best thing to do in this case is to contact the help desk. And I've given you the link there to the help desk. You can just enter in your name, your contact information, and what the issue is. Just say, I have this paper. Here's the NIHMSID number. Can you please expedite this? My progress report is coming up in 3 weeks. Please make sure that this is done. And it does help to bug them. They do respond. They're a little bit slow, may take a few days or a week, but eventually they'll respond. So to summarize, the first thing is to determine what type of journal it is. The second thing is to determine where the breakdown occurred. The third step is to identify an author you can communicate with. The fourth step is to politely ask the author to do what is needed, and then to offer to help the author if they're encountering a problem or a difficulty, and then finally to follow up on a regular basis. And you have to follow up, every week. Same with the help desk. Maybe every week go and put in a help desk ticket and say, this is important. Just keep nudging people week after week. So any questions about troubleshooting? We're almost done. The last section will be on strategies for enhancing compliance, but this fourth point under troubleshooting is very helpful. I think some good practical things there, and keep track of those links to all those lists. That'll be very helpful for you. Those are also helpful if you're just an author and you're getting ready to decide what journal do I want to publish in. Those links will also be useful for determining that. Any questions? Okay. So strategies for enhancing compliance. So the first thing would be to provide training seminars such as this one in collaboration with the officer-sponsored programs of your institution or with your librarian. Dr. Irma Quinones has been very helpful and proactive in providing training and leadership in this area, and we're thankful for her contribution. Another strategy for enhancing compliance is to have a plan for how to communicate on these things. So let's say you are a program manager for a grant. Work with your PI and come up with a plan for how you're going to communicate about these issues. You have in mind, okay, I know that my progress report is due sometime in the spring, so maybe in November and December, about 6 months ahead of time, we'll send out an email to all of the faculty, all of the collaborators that we know of in our program, and we'll remind them about the public access compliance issue, and we'll give them some tips, maybe send them a PowerPoint to give them some directions, and just keep communicating with people, keep reminding them so that it's on the forefront of their mind. Another key thing that you can do is to be proactive by budgeting ahead of time so that you have money in your grant for paying the open access fees. So we already discussed this issue, but if you're aware and you kind of are anticipating that, I know there's going to be 2 or 3 papers that I want to publish in a very high-profile, high-impact journal, and I'm pretty sure they're going to require a fee, then budget a few $1,000s in there for that so that you're ready for it. You're not caught by surprise at the end. I would also recommend that PIs and program staff continually go to PubMed. I would do it several times a month, maybe once a week or every 2 weeks. Go to PubMed and just type in the grant number, and it's amazing what will pop up. Within the last 2 weeks, a new paper came online. Here it is. It's in the system, but it doesn't have a PMCID number, so you can catch it right then and start contacting the people involved. And another key thing that NIH has done, because they know this is an issue, is they have created this thing called the Public Access Compliance Monitor. This is a very helpful tool that is an institution-wide tool. So the Public Access Compliance Monitor is a tool that allows the institution, so let's say you here at UPR, Medical Sciences Campus, you could have someone that can log into this monitor to see all the papers that are associated with every single grant that is located here at this institution. What you should do is you should ask your office-sponsored programs to assign an individual, a staff member here at the school, to be the Public Access Compliance Role, PACR. And this person can only be assigned by whoever it is at your institution who assigns ERA Commons IDs. So there's somebody here who is responsible for giving investigators their ERA Commons ID, that person would also be the same person that could assign the PACR. And this is the link to it. You go to the compliance monitor, you log in using your ERA Commons or your NCBI login credentials, and this is what it looks like. I know it's very small print and it's hard to see, but these are just a list of all the papers that are coming out of your institution. So let's look at the top one here, for example. Here's the PMID number for that paper. Here's the PMCID number for that paper, so it's in compliance. Here's the NIHMSID number. Here's a list of all the grants that are supporting that paper and all the PIs of those grants. And then as you keep going across there, it gives you the dates when everything happened. It'll tell you the date when it was published, the date when it was submitted to NIHMS, the date when it was approved by NIHMS. So the thing is that whoever has this responsibility, whoever logs into the system, they'll be able to see at a glance where papers are at in the process. So the next paper down, this paper here, that one's also in compliance. But the third paper has a problem because it was published on this date, but the rest of the fields are blank. So that tells you that that paper has not yet been submitted to the NIHMS system, and there might be an issue there. So that's a very helpful tool that your institution can use, and then that person can call up the PI and say, you should check in your NCBI and look at these papers and make sure you get them ready. So to summarize then, conduct trainings for all faculty and staff. Utilize your Office of Sponsored Programs and your librarians like Dr. Quinones. Communicate. Appoint someone at your institution to take on the public access compliance monitor role, and you should be good to go. So any questions about enhancing compliance, or any questions about anything that we talked about today?